Pregnancy, undeniably one of the most profound and miraculous experiences in a woman's life. The journey of pregnancy is not only a physical process but also a spiritual and emotional one, where a mother nurtures and protects her unborn child with boundless love. It is therefore so very important that utmost care must be taken of the mother and her child during this most crucial and delicate period. Antenatal care is designed to make pregnancy safer for women by detecting complications early and ensuring timely treatment. At least 4 antenatal care visits are recommended to monitor the health of the pregnant woman and her fetus. Talking about rural India, just about 54% of mothers attend the recommended antenatal visits compared to 68.1% in urban areas. Many times due to hospitals situated at longer distances, or household and farm work, or sometimes due to poor transportation services. And so the consequence, increased risk of pregnancy-related complications, at times leading to death. A recent report published by UNICEF India estimated over 26,000 pregnancy-related deaths in 2018, which accounts to over 97 maternal deaths per 100,000 live births. Staggering figures rising out of a simple issue: pregnant women unable to reach the healthcare centers for routine checkups. Senthil Kumar Murugesan, a young man from Madurai, Tamil Nadu, experienced a similar plight for his sister. Being a working woman, she too was unable to attend her antenatal appointments. Senthil was concerned that his sister must not enter the labor room with any kind of complication. So he met the doctor and understood that the pregnant woman is considered either healthy or prescribed medicines only on the basis of healthy functioning of her vitals, that is, blood pressure, blood glucose, ECG, and temperature. So he asked the doctor, what if the data of these vitals can be monitored at home and provided to you? And the doctor answered, that would be great. Senthil saw a ray of hope in this conversation. An electronics and communications engineer by profession, he started developing a device that had the capacity to measure the vitals of his sister, like blood glucose and blood pressure. After a good research and efforts, he developed a prototype and asked his sister to use it. This device proved to be a blessing, thereby ensuring a smooth and happy pregnancy experience. This incident helped Senthil awaken the genius within him. He could realize that so many women in rural areas face similar challenges in visiting hospitals for antenatal care. After creating a simple device for his sister, Senthil felt inspired to assist more women, particularly those in the rural and remote areas. After 3 years of consistent trials and tests, in the year 2019, Senthil founded Jiovio Healthcare, a humble startup aimed to provide healthcare benefits to pregnant women situated in rural belts. The company's product named as Allo Tricorder, a device which helps in monitoring the vital parameters like blood pressure, blood glucose, ECG, and temperature of a pregnant lady. To promote this service, Senthil approached the state government requesting to furnish him with the details of mortality deaths in every district. Once the list was received, the district collector was contacted, who then helped in appointing a joint task force comprising of block-level officers, healthcare workers and healthcare professionals of ASHA, accredited social health activists, female health experts at rural levels. The ASHA female health workers were provided with the Allo tricorder, used to monitor the health status of pregnant women. The data generated was digitally transferred via Bluetooth to the central database at the hospital. Eventually, this data was analyzed by the doctors and ascertained whether any lady needed to undergo lab tests. Accordingly, the lab tests were organized. Senthil also created a smart wearable device called AlloWear, designed for high-risk pregnant women who needed continuous monitoring. Senthil's unique initiative has helped to reduce maternal mortality by over 10% by taking the benefits to over 1,000 women, a figure both impressive to start off with. He further aims to spread this awareness to the whole of South India and also plans to launch his company's operations in North India. Apart from maternal safety, Senthil has been actively engaged in community empowerment and educational initiatives among girls and young women under the initiative called MetooMentor, a non-profit organization aimed to mentor young women to innovate through technology. Senthil also comes with a unique vision to build technology-enabled self-sustaining communities in Madurai region. Feat he knows can be achieved only by bridging the digitally divided groups and by empowering the powerless and the vulnerable sections of society. The world as we see today needs more of people like Senthil Kumar Murugesan, who have awakened to the threat posed by critical issues like maternal mortality that seep in through the lives of rural India. People who are convinced to strike hard and come up with welcome solutions that helps to create a lasting impact on the lives of the poor and the commoners. Thank you for watching the video. Do like and share. Also do subscribe to our channel for equally more interesting videos. Thank you.